Mogadishu's Martini Hospital has a new coronavirus ward, but in a country wrecked by nearly 3 decades of violent turmoil, there's still work to be done. That's according to Dr. Abdirizak Yusuf Ahmed. He's a veteran of Somalia's conflict zones, a man who has escaped execution at the hands of militants. Today, he's building the country's defenses against a new danger, COVID-19. He says the country is fragmented and its facilities destroyed, with no intensive care unit ready at the moment and very few health provisions. And the 35-year-old says it's the elderly, poor and malnourished who are most vulnerable. That's of particular concern in Somalia. The country has only reported a handful of cases so far, but the fear is that COVID-19 could spread rapidly through camps that house malnourished families. Displaced by conflict, 2.4 million people live in such camps, and the UN estimates around 6 million from a population of 15 million may not get enough food this year, weakening their immune systems. Al-Shabaab insurgents also hold parts of southern Somalia, making it hard for health workers to visit and impossible to do testing there. Ahmed knows the dangers. A decade ago, he and his team were seized in Al-Shabaab territory as they tried to stem a cholera epidemic. They only escaped due to a call from a high-level contact. Today, Ahmed hopes it's the measures they've put in place that will save lives. He says Somalia has a preventative plan based around self-isolation, quarantine and awareness. The government has allocated funds of $11 million, though expenses are high as medical equipment is imported and coronavirus tests are sent to Kenya for processing. 500 health workers have been trained since January, the World Health Organization's country representative says, and personal protective equipment for the first 300 to 400 cases has been brought in.